Welcome to today's episode. We're diving into a topic that matters to so many people, understanding depression and how to heal from it. Ready to jump in?
Absolutely. It's such an important conversation. Common, complex, and often misunderstood. Let's start with the basics. What is depression?
Good place to start. Depression is more than feeling sad for a day or two. Clinically, it often means persistent low mood, loss of interest or pleasure in activities, changes in sleep or appetite, low energy, difficulty concentrating, feelings of worthlessness or guilt, and sometimes thoughts of death or suicide. If these last for weeks and interfere with daily life, it's a sign to seek support.
A key point. Feeling down sometimes is normal. Depression is when those feelings are intense, persistent, and make it hard to function. And there are different types. Major depressive disorder, persistent depressive disorder, postpartum depression, seasonal patterns, and more.
People often wonder what causes depression. It's usually not one thing. Biological factors like genetics and brain chemistry, psychological factors such as negative thought patterns and trauma, and social factors like isolation, stress, or major life changes can all play a role. Often it's a mix.
Exactly. And life circumstances, losing a job, a relationship breakup, bereavement, can trigger it. But sometimes depression appears without a clear external cause, and that can feel unfair and scary.
Let's bust a myth. Depression isn't a sign of weakness or something you can just snap out of. It's an illness with biological and psychological components. That said, there are practical steps that help recovery, and many people do get better with time and treatment.
So if someone suspects they're depressed, what should they do first? Step 1. Talk to a trusted person about how you're feeling. Step 2. Reach out to a healthcare professional, a GP, a psychiatrist, or a licensed therapist. They can assess symptoms and recommend treatment. And if you or someone is in immediate danger or having suicidal thoughts, contact emergency services or a crisis hotline right away. For example, 988 in the US, or your local emergency number.
Yes, safety first. For treatment, there are evidence-based options. Psychotherapy, like cognitive behavioral therapy, CBT, helps people change negative thinking and behavior patterns. Interpersonal therapy addresses relationships and life transitions. There's also behavioral activation, focusing on re-engaging with activities that bring meaning, even when motivation is low.
Medication can help too. Antidepressants can correct certain neurotransmitter imbalances and make therapy more effective for some people. It's not a one-size-fits-all. Some people do well on meds, some benefit most from therapy, and many do best with a combination. Medication decisions are made with a clinician based on symptoms, history, side effects, and personal preferences.
Lifestyle changes matter a lot and are within reach for most people. Regular sleep, balanced nutrition, physical activity, and minimizing alcohol or recreational drugs can all make a difference. Exercise, for example, releases endorphins and supports mood regulation. Even short, regular walks help.
And don't underestimate routine. When depression knocks your energy and motivation, building small, predictable structure, set sleep times, simple daily tasks, short goals, can create momentum. Celebrate tiny wins. Progress often feels slow, but small steps add up.
Social connection is key too. Isolation feeds depression. Reaching out to friends, family, support groups, or peer-led communities can reduce loneliness and give practical and emotional help.
Mindfulness and stress management techniques are helpful supplements. Practices like mindful breathing, grounding exercises, or short meditation can reduce rumination, that repetitive negative thinking that deepens depression.
Self-compassion is a big one. People with depression can be harsh on themselves. Learning to treat yourself with the same kindness you'd offer a friend matters. That might mean adjusting expectations and giving yourself permission to rest.
What about preventing relapse? For many, depression can be episodic. Maintaining therapy or check-ins with a clinician, sticking to healthy routines, recognizing early warning signs, and having a plan for when symptoms start to return can reduce the chance of a full relapse.
Let's talk realities. Healing isn't always linear. There are setbacks. Some treatments take weeks to help. It's okay to try different approaches until you find what works. Support networks and clinicians can guide that process.
Also worth mentioning, if finances or access are barriers, there are low-cost options. Community health centers, sliding scale therapists, online therapy platforms, and support groups. Some crisis lines and text services are free. Don't let cost keep you from reaching out.
And for loved ones listening, how should you support someone who's depressed? Listen without judgment. Ask how you can help. Offer practical assistance, like going to appointments or helping with small tasks, and encourage professional help. Avoid minimizing their experience or offering simple fixes like cheer up.
Before we wrap up, a quick checklist for anyone concerned about depression. 1. Notice symptoms and how long they've lasted. 2. Talk to someone you trust. 3. Contact a healthcare professional for assessment. 4. Explore therapy, medication, and lifestyle supports. 5. If there's any risk of harm, contact emergency services or a crisis hotline immediately.
Recovery is possible. Many people find relief and go on to lead full, meaningful lives. The combination of treatment, support, and self-care can change the course of the illness.
Thank you for joining this conversation. If this episode resonated with you, please reach out to someone you trust or a professional. And if you're in crisis, get immediate help. You don't have to go through it alone.
We hope you found this helpful. We'll be back with more conversations, and until then, take care of yourself.